Hey guys, I'm Sean Hensler. I'm the PA at Recharged IV Hydration Clinic. I want to show you something that we have that's really special to this area that's been a huge help to our community is IV ozone. IV ozone is, we actually are going to be, we drain about 200 cc's of blood into a bag that's already been pre-mixed. And then what we end up doing is we hang it, and then we actually put a certain amount of gamma of ozone into the bag, and then we mix it, which you'll see, and it super oxygenates that blood so it turns bright red. And after that's done, we put it back in the patient, and it develops peroxases. And so the three big things that IV ozone does is it kills bacteria and viruses in the blood. So we're talking about COVID, maybe long COVID. We've had patients with long COVID that we were able to actually get them back on their feet within a couple treatments. And even with Lyme disease, that's huge, mold toxicity. So as well as just preventatively, it keeps your body and your blood tip top. So what we got here is we have this is an ozone bag, okay, and I've already put the right amount of normal saline within this, and there's also going to be 1 vial of heparin. So this is why we make sure you don't have a coagulopathy, or you don't have anything like your own blood thinners or anything like that. So after this has been mixed, what we do is we're going to hang it here on, we call him Dr. Turtle, and we're going to get our IV set, which is a blood administration set, which means it has a filter in it. So if there's any potential blood clots that could be trying to get back through the system here, when we're putting it back in, it will catch it within this. So it's a very unique aspect of it. So we're going to be going ahead and taking the top off here. So right now I have heparinized the line. So the whole line has been coated with not just norsaline, but also with heparin solution, which helps it flow down the line much better. So then what we do is we take this guy that's already pre-mixed, has everything we need in it, and we're going to walk it to the patient. It has already been catheterized and ready to go. Our patient here has been sick for a little while, and we're wanting to get rid of the bacteria and the viruses, and we want to decrease inflammation. So this is great for autoimmune and all kinds of anti-inflammatory. Got it. And then we're going to go ahead and unclamp this. So now we're going to go ahead and get the blood rolling. And once we get 200 cc's of blood, we're going to ozonate the blood. So we're going to essentially treat the blood. All right, so now the patient's blood is reaching the level that it needs to be. So we're going to prepare the ozone gas. I already did, if there's 200 cc's of blood, there's 200 cc's of gas. It's a 1-to-1. So now it's off to this. So I'm going to go ahead and unscrew this. And ozone is heavier than air, so you could keep it like that, but we take a little extra precaution and cap everything. So the oxygen is going into the ozone generator, making O3, and it's going into here. And this is called a destruct, so that'll neutralize any of the gas if need be. And go to 60. So right now it's off here, so it's going into the destruct, so it's getting neutralized. And upside down. Cap it.
good because I'm starting to think.
Okay, so now that we have the amount of blood that we need, venous blood, we're going to go ahead and add the ozone gas to the blood.
We need other people to eat them or right back.
You see how dark it is there? And now you're going to mix it. And this is where the ozone, the O3 molecule, is going to bind to the hemoglobin, which is going to cause a oxygenation reaction. So sometimes you can do it for 30 seconds. Sometimes it takes a little bit more depending on the patient's blood. And start to turn now. See it changing? It's really changing. See the difference? So we're wrapping up right now, and the ozone gas has been put in, the reaction has occurred, and now we're infusing it back in the patient. And when it's down the bottom, we'll either go ahead and clamp it off, or we'll add a hydrous vitamin C or bag, something like that. But yeah, this is all it takes. You know, it's fast, it's effective, and it's largely only here at Recharge IV Hydration Clinic. So if you want to learn more about the IV ozone, even have ozonated water that is fantastic for killing any bacteria in your mouth, down your esophagus, even down in the stomach, helps with peptic ulcers and such. Just call our office, check out the website. The website has a lot of information. I made it simple for you guys to really know what's going on. I put our training video literally on the website. Either call the office here or ask that you want to talk to me, and I'll give you more information. So I appreciate you watching. Thank you.